G14, the cut back on a Thursday evening, and also, as it's been for the past couple months, breaking news and just updates once more. Wow, what a year! 2020 here tonight to talk about the coronavirus, calling it the COVID-19?
COVID-19. Yeah, 2020 has been crazy, absolutely nuts. But this is something I've never seen before. This is real different. And I know people bring up other, diseases and things that have been mentioned over the past years, but it's just getting real for me, especially, and a number of people I talk to. Never seen them shut down any type of NBA games. Never seen them even entertain playing with fans not being in the stands.
Right.
Never seen Disney World close. Mm-hmm. Never seen Disneyland close. Never seen March Madness canceled. So that tells people, let me make this clear, those type of big entities are not trying to lose those millions and billions of dollars for absolutely nothing. Mm-hmm. This is vetted information that they have that made them say, you know what, we can't take care of this right now. So to be safe, we got to lose all of this money, stop all the tradition that's been going on for decades and decades and decades in everybody's life who lives here in America, all across the world, because you can watch basketball all across the world. That should tell y'all something. I don't care how many people are going to end up surviving it. God willing, there's minimal deaths from it. But what it's basically saying is this stuff is highly contagious. A lot of people are going to end up getting it. And the biggest thing that people need to know is they don't have enough tests for it right now. I think that's when they decided we have to basically decrease as many people getting this virus as possible, because we can't handle it if everybody's getting it.
Absolutely. And it just comes a time where it's like, all right, we need to sit down. We don't have it under control. We thought we had it under control. We thought we could tell everybody wash their hands, do this and that, and it's not getting any better. Everybody's still traveling, going on cruises, just resuming as normal. And I think the number one thing, there's a lot of key points, but a lot of it is everybody's like, oh, relax, calm down. We are relaxed, but we do need to take heed and be prepared and, look at it for what it is. And like you said, if it was a common cold, then it would be a common cold. Nobody's going to lose billions of dollars. And now we're talking in the trillions when you're discussing healthcare, as far as people needing to be tested or going in for symptoms and ER visits and things of that along that line. So it really gets to be it's been serious, but I really hope that now people are starting to understand. Well, they don't really have a choice. I mean, everything's getting shut down. You don't really have a choice but to take it serious if you haven't already. Even before you and I just got on just now, Ohio and Maryland, they're the first two states in the United States to shut down all their public schools. Now, given account population, but they have closed all of their public schools, and of course, several cities. We talked about Atlanta over the phone, you and I, and a couple other cities that have closed their schools down because, again, it's just time to sit down. Cleaning and sanitizing isn't enough. We don't know how many people are infected. There was a report that came out that stated that, when this is all said and done, half of the U.S. population will be infected. Not that half will die, of course, but half will be infected. And then gave a percentage of people that will surely, not make it, just due to obviously statistics and previous health, data or whatever they have available. People with, lung respiratory issues already, and just, elderly, and just, immune system, things along that line. And another thing I wanted to mention was last week, and you and I we've been talking about this. Last week, they said that the patients that were being treated in China were receiving AIDS medicine. Now, whatever that consists of, I wouldn't know, but that should tell you something, because if I'm not mistaken, I believe that medicine is very costly, and that's pretty progressive. This isn't HIV, this is AIDS medicine. So that's the treatment that people are receiving and recovering, when they recover. So when you talk about how many people have been tested and tested positive, and the treatment that they're receiving and what levels, it's pretty intense.
Absolutely.
And then to double back and say some of them are not recovering, that some of the lung damage is irreversible. That's pretty intense.
That's a big issue, because even if you get over it and the strain's still in you, it doesn't, your body doesn't relieve itself of it totally, that stuff can, come back, I mean, it depends on what's the vaccine. Right now, there is none. People are just literally getting over it from their immune systems. So compromised immune systems, like they keep saying, are the most vulnerable. So again, when the flu has a vaccine, the flu does. This doesn't. No. They don't even have enough tests to test everybody. I personally know some people that work with a guy who's trying to get tested, and they turned him away like 3 times because he's been sick for days now, and he thinks he might have it. But they literally told him, you got to make sure you got a primary physician. Your primary physician has to recommend you for it. Then they got to get these tests for it. So when you're seeing the NBA players getting tested, keep in mind, these are rich organizations, and even theirs is taking days to get done. There's I believe Oklahoma City was still in Utah for like 2-3 days before, they were able to even leave. They might still be there because these tests aren't just readily available. So the measures you see that are being taken, that some people consider drastic, some people say they're overreacting, is because they know that they don't have the capability of keeping this thing at bay, because they don't have what it takes to do it right now. So they're trying to tell you, stay out the streets, stay out these venues where it could spread, because we can't take care of y'all right now. That's the biggest thing on this, is let us get a handle of all these tests, all this information we need from CDC, all of these, hospital wings and stuff that we probably need to build to make sure we can take care of the people in the area. You got places like Seattle, they're getting hit hard. You got places now like New York, I believe it's over in Long Island, where they're getting hit hard. But then you look at places like Italy, where they let it get out of control. We're talking about 200 deaths in 24 hours. 200 people dead in 24 hours. They're literally suspending mortgages. Like, we're not even sending you a bill for living in your house. We don't want nobody out anywhere.
Right.
So hopefully that doesn't get like that over here, because it'll be hysteria. I just came back from the grocery store trying to stock up. It's crazy in there right now.
It really is. And then, I'm currently in the Las Vegas area and a tourist city. And to be honest, I'm quite concerned because we're there's a little bit, I'm away from the strip, so there's a little bit of, not, well, how should I put this? We're acting as though, as we should, we're taking the concerns serious and moving, living our life, but taking them serious, taking precautions, and as we should. But I'm still seeing traveling and conferences, and I'm just like, wait a minute. It's time to shut it down,
Barely.
It's okay to sit down for
I'm
a few
surprised
months.
you're seeing them, because I'm seeing them. I know they're getting canceled left and right around us. Big conferences,
Yes.
medical
And,
conferences.
and maybe, maybe they just haven't got around to announcing things or whatever the case may be. That could be the case. But it's alarming because, you guys have to sit down. You really do have to sit. Now, this is an introvert. I do sit down all the time, but I do still have to move about for business reasons. So it affects everybody. The tours, music industry, I'm seeing a lot of tours getting canceled. Comedy tours, albums are being pushed back. A lot of things are happening. A lot of people are going to feel this. So we're all in it together. And this is a time where literally, like, your status and money, your money can hold you over, obviously, a little bit. You have, your savings and things like that. But this is a time where everybody's affected, the whole world. It's not even just a U.S. issue. So we have to...
Global economy.
Exactly.
Global economy, it could be a wrap, like,
Yes.
in a hot minute if this thing keeps
Yes.
progressing. This is
Yes.
big. People losing a lot of money, 401k, stock markets. People losing a lot of shit
Yes.
right now. And
Yes.
just go back and read who cut the CDC budget about a month or two ago.
Yeah.
Boy, good old Trump. Cut the money to that place probably like a month or two ago.
Mm-hmm.
Budget cuts, but then you get all this big spending on the military for the wars, and you want to have the huge armies. You're not preparing yourself for these new epidemics that's going to come about. You got people barely running up on you in wartime with guns and all this stuff. Right now, people are using cyber warfare. People are using shit like pandemics. This is the stuff you got to get ready for. And what do? You cut the budget to the CDC, and now you need them. So now you just had to literally give them money back because this is making you look crazy. People, see, we're hearing this stuff now. People had warned these guys months ago. There was a doctor on television yesterday saying, listen, we've been telling the administration about this. I can't believe y'all not ahead of the game. He knew. They knew. But he was calling it a hoax. Just something they trying to get you riled up about. Now look, this shit is spreading like wildfire. And you playing from behind at this point. Playing from behind is never good.
Yeah.
So now you're playing catch up.
I've never been a fan of reactive moments or things like this when you have an opportunity to be proactive. And if there was no better opportunity to be proactive, this was definitely one. We saw what was going on over in China, and we were still, traveling, doing, all of that. Just, there were no concerns. It was just, media. No, this is actually a time where you actually need to pay attention to what's being done, especially when it's global. That's when you really know to pay attention. There really can't be too much of an agenda when everybody's affected, especially when corporate America gets their hands involved and loses, like you said, all this money. And again, billions and trillions of dollars here. We're talking about the healthcare industry and the insurance companies that are going to be hit with the long-lasting effects of people that develop maybe further complications. Again, this is brand new. So we're saying they recovered. We don't know, and not to be a negative Nancy, but we don't know what's going to happen next year. You know what I mean? We don't know what effect, what the long term of, and that is when people talk about vaccines and things like that, they have to take all these things in consideration. What the side effects are, who can have it, who's less, who's less responsive to it. There's so many things with this. It's not even funny, and every person is different. Each situation is unique, so it's very serious, and you have to sit down. The less people infected, and the less it spreads, and the less we can kind of get a handle on it. But that's the main concern. It's just the fact that people haven't sat down, and it doesn't look like they are.
Well, you got people that don't believe in certain things. That's another big thing when it comes to voting. It's all coming back to, how we could protect ourselves and that we actually control the government, not the government controlling us if we get our minds right when it comes to political power. You put somebody in power that don't believe in science, then when shit like this happens, they're just going to brush it off until motherfuckers start dying. Then everybody's around him telling, hey, you need to take this serious, man. What is wrong with you? This guy don't believe in science. So he's in there right now taking it as a joke. But then when you see what happened, and you know what's going on in China, you know what's going on in Italy. If you think, that's not going to happen in America, now you got to deploy National Guards to different areas to help clean shit and all.
Right.
It's getting out of hand, man. We wanted to, if not the smartest country, we were. I don't even know if we have that title now, but it's a shame that we don't, because we like to claim everything else, and I just want to be frank about this, because we should have a handle on stuff like this.
Right.
Like, keep in mind, man, there's a lot of people in different countries that have drugs that can cure a lot of shit. They were just talking about this last night on one of the news networks on how there's a bunch of drugs like in Mexico and Canada that we can't get over here through insurance that literally can cure a lot of people of a lot of shit that they have over here. You don't even know about it because the big pharmacy industry is running a lot of shit. The money is keeping you sick. That's what the money is in keeping you sick. It's not getting you better. So while you got, I forgot what was one of the diseases. They had a whole list of different diseases that people get cured from, or outside of the country all the time. And I was sitting there like, wow, they getting that shit and getting cured off of some medication, not surgeries and shit. But when you got a massive conglomerate that makes money every day pumping these drugs into you, you got to think about it, man. Like, what are we gonna do? Look at the people that's running this whole shit. And then that's when I'm not telling anybody who they should be for, who they should be against. I'm just giving you facts of what's going on. You got guys that talking about taking it. Just put it, literally, take politics out of it. Put it in your neighborhood. If you got a strong block in your neighborhood and all they do is sell drugs and they making millions of dollars a year, go ahead, try to go against them. They'll be riddling your mother's house with bullets. Because they don't want to see the neighborhood clean. They making too much money off the block. Same shit when it comes to anything else. It takes a movement of people to shut these people down.
Yes. And when you talk about, I was just talking about this earlier with my mother, just in general about voting. And, we've been talking about voting for years. I mean, we've been talking about voting for years. Since we've met, we've been talking about voting.
Yeah, it's important.
Prior to the with Trump being elected, and just during the Obama, because there's different levels, and we talked about that. And everyone that doesn't believe in voting or participating in things such as census reports and data, all of this stuff is important. All of this helps to allocate funding or open up certain congressional seatings or make sure we have certain bills, and helps to put things in place and in order and certain protocols to help at least put people that do believe in the science and believe in the things that we need to prepare. And then when these moments come, there's a little bit more guidance and assistance versus just the resistance. But it's a very real thing, and it's just this whole the whole government. I get it, because we've had such a terrible history, when it comes to that, with Malcolm X, Martin Luther King, just in our Black history alone. We've had some terrible, we've had some
pro, slave codes.
Yeah, we've had
Jim
some terrible. Yeah, we've had. So I get it.
Shit.
Yeah, I totally understand. I understand where it stems from, but at the same time, we have to start thinking logically, and then allowing ourselves this time when we're sitting down, use this time to educate yourself while you're still able to use your internet and everything else. I don't think that's going to go out, but I'm hoping that everything, they get a handle on it. The sooner they shut down things, the better they get a handle on it. I just see it, everybody talks about apocalypse and all of that. I don't see it getting that extreme, but I do see there being maybe a curfew or something like that in place, them shutting things, or just maybe things closing earlier, where your store may have closed at 9 or 8, maybe they're closing at 5 now, or whatever. Maybe your job is closing earlier, a couple of businesses, because they can't afford to stay open that full, scope of, depending on your scope of business. So there are going to be some hours of operation changes coming. There's going to be a lot more structures, but, maybe not immediate shutdowns on things, but they're going to definitely change some hours of operations. There may be some limits with these stores, because I see that people are, doing the whole, like you said, you can barely buy anything. So there's definitely going to be a lot to come, but take this moment to educate yourself, if you will, on how do we, I guess, bounce back from this, because this is definitely, we're going to feel this for a couple of years to come. I mean, I know that you guys like to think that everything is going to be, we're all going to get better, and, we're going to be feeling better, and that's great. We need to be optimistic, and we are going to feel better. But the truth of the matter is, a lot of, things are going to change. That health insurance policy, it's already expensive. That's going to go up. Once all this is over, you're going to be paying more money on that. There's just a lot of things that are going to happen. So voting matters.
Just be prepared the best you can. You got to get prepared, and you got to listen. I mean, if people aren't smart, by now, what you have to do is, these news outlets, the social media memes and all that shit, stop it. Stop learning from that shit. Mm-hmm. Y'all out here posting shit, that articles from 2015 talking about, check this out, and it's old as shit.
What?
You're not even opening the article to even read what it says. You just literally posting shit up. People gotta stop doing this, man, because they understand that this is how you're learning now. This is how you're learning. You're learning through what they call troll farms. They literally have buildings of people paid to skew your thinking when it comes to social media. Matter of fact, they just did a report that Russia has African people doing this now. They literally ran up on this dude, a Ghana citizen. This dude is out here driving a candy red Mercedes Benz with the black rims on it, wheels on it. I mean, he kitted up out there. And they roll up on him like, yo, what's wrong with you in these troll farms, man? Like, what are you out here sowing misinformation for? He tried to act like he don't know what they talking about. They did the whole story on him, showed how many people he had working for him and everything. So they literally got brothers out here trying to sow misinformation, racial misinformation, so you could vote another way. They had it again already.
Clickbait too, just trying to get up a couple of, like you said, ad money, dollars, and things of that nature. Yeah.
Oh, all types of voter suppression. All types of voter suppression. All types of tricks, all for your vote. So if you don't think that your vote means anything, why wouldn't it mean something when it means so much to them? They willing to spend millions of dollars to try to take it. They willing to systematically just structure something that's going to end you from putting your voice out there, for putting your vote out there. Why do you think they got buildings full of people that just send social media trolling shit for you to believe? Because they know they don't research nothing. They just look at what they look at what they see on social media and run with it. Before they find out that it's not the truth, 800 people done checked it out, and 500 gonna believe it. Those are good numbers for us. That's literally how they think about everybody out there right now. From Facebook to Instagram to everything, the social media stuff is different. So if you want to stay on the COVID-19, look at the CDC information. You know, matter of fact, start looking at these other countries, because they putting the truth out there. They don't have no media spin really to what they got going on. Sometimes I check out BBC. Sometimes I check out Al Jazeera just to see if what I'm seeing and hearing over here is jiving with what they're talking about over there. Check out the United Nations, what they're saying about it. Because it's that real.
It really is. And I think what you said was, that really is just like the gem of it all. That kind of just even hit home for me when you said, if they're spending this money, then why wouldn't it be important?
Absolutely. And that's what they're doing. A lot of money to take your vote away. A lot of money to take your vote away. Why do you think the system is hitting people with felonies like they are? They know. They already put that in place, that if you got a felony, you can't vote, right? So now it took years. Look, you know how many people can't vote because they went in jail? They could be out on the street right now, got a felony. They don't even think about voting. But now people are starting to wake up. Hey, man, if you had a nonviolent felony offense, you should be able to still vote. Now there's movements across the country, but you just go look at it yourself. You don't gotta believe nothing I'm saying. Go look at the people that's trying to stop the nonviolent felons from voting and what party they belong to. Just go check it out for yourself.
And that's a fact, because I've definitely been keeping an eye on that as well. The new movement where they're trying to put that act into place for them to still be able to vote. There are definitely a lot of things in place to try to restrict us from those votes, and each vote does matter, and your participation matters, and your education matters, and I'm just, it's one of those things where we really, it's out of your control, but what's within your control is the advisories. If you're feeling sick, what was the story I sent you? The guy, he went and got tested, and he traveled and got the test results on the plane, but he was already, I guess, feeling sick, but still got on the plane. And, so all those people now on the plane,
and there probably wasn't a lot of them, because people ain't flying like that right now. I got a couple of homegirls that work at airports. They was putting on live video how many people were in the airports. Shit was empty. Oh, wow. Empty. Really? I'm talking about empty. I was waiting for tumbleweeds to flow through there. I was like, wow, there's nobody there. She was like, no, I'm getting nervous. I'm getting nervous right now because, we don't know what's going to happen. But like Onyx said, man, when you're dealing with advisories, things of that nature that they're telling you about this virus, listen, just take heed. If you want to be out there reckless, be in everybody's face, still do your thing. That's cool, but just take heed to what's going on, because it's going to be a lot of poor people, lower middle class, that can't get their hands on this test. They're not going to be able to get tested. Right now they're lobbying for free tests to the Trump administration. I believe that they are going to allow the free test. There was a lady lobbying for, Trump administration, here's what she has to say. And I do believe that they're saying they are going to allow the tests to be free. Where are they going to send them? Who's going to have them? Who's going to be able to get it? See, this is what, minority communities got to, understand. Mm-hmm. It's just like anything else. You wonder why you don't got the good school supplies or the good desks or the good books. Mm-hmm. It's always complain like, why we don't get that stuff? You got to look who's in charge right around you. Because there's budgets being sent. It's just, where's it going? Is it going to your districts? Is it going to somebody else's districts? It's the same thing with this. So if y'all see that people are coming back like, hey, man, I wanted to get tested because I was sick, but they wouldn't let me. Y'all might want to start raising hell in that area.
Right.
Because it's that real.
And this is a time where, you've talked about this before, and, I've chimed in about it, where you do use your social media. This is the time to be ranting and doing the most. You know what I mean? I'm not saying, this is when, if there was never a time before, this is it. You know what I mean? So you can definitely, this is the time you should do that. And I'm pretty sure, someone can help guide you or get you to it. And they're saying that you should be calling the CDC. And I've heard the same thing you said about people having to have their primary care, do this and do that. But since, as of yesterday, or it may have been early today, that being rolled out. But again, it's a money thing. We're going to feel those effects. And we, as in everybody at every level, but definitely middle class and then the lower income families. And then keep in mind, just because you're feeling good and you've got the best immune system in the world, and it's the other people, it affects them. And then they go back to their families and their people, and it affects them. And some kids are being raised by their grandparents. Some people are being raised by foster families who are, older, much older, and that's what they do. They care for children, and they can't afford to, you know what I mean? Just think about
Absolutely.
those.
You have to look out for them.
Right.
You got to look out for them.
Exactly. So it's not just you. It's the fact that if you catch it and pass it along, or whatever the case may be to everybody else, that's kind of the issue here. So really, let's use some critical thinking. Let's have a seat. It's okay. Calm down. And it'll be okay. It really will be okay. But you guys have to sit down, and you need to educate yourself and definitely be prepared. Speaking of being prepared, we're in the process now of having a doctor come on. Won't go into detail. We'll have a doctor that we're trying to get on the show and do a maybe more direct and maybe more data-driven, and just, she's a doctor, going to have that information available and share that with us and answer questions that maybe you and I have, or just kind of get more into it than, further what we can. We're obviously just speaking from anybody would, a U.S. citizen's perspective, but this was very important. I never thought
I'm happy that she's coming on so we can have a real conversation about it, with somebody that's an expert, done the research, knows a lot about it. So we should definitely have that as soon as possible, because this isn't going anywhere anytime soon. It's really just the tip of the iceberg for us over here in this country. So let's all try to stay as safe as possible. And again, let's emphasize that point that you just made. You could carry it to your elder. Some of my parents, 60, 70 years old, you know what I'm saying? Those are the people that's having a hard time. 60 years old having a hard time. You know what I'm saying? So when you say elderly, we're not talking about have to be 85 and rickety and, 90 and, don't look at it like canes and walkers and shit. Just look out, people's immune system start getting low, late 50s, 60s, depending on how they taking care of ourselves. A lot of our, in the community, folks ain't eat the best, we out here, kind of young and not eating the best. You know what I'm saying? Like that's a whole different
That's a
topic.
whole nother show. Right.
That's a whole nother show. You know what I'm saying? So, we want to be able to get over stuff, the way we need to, but sometimes, people don't. And let's just, be courteous of others. And again, we got to look out for ourselves. But we're gonna pick this topic back up on Monday with an expert. We're gonna dive into it because it's serious. But we just wanted to hop on tonight, talk a little bit about it. Don't just act like this is play. People ain't losing millions and billions of dollars because it's a plaything. When you see these corporations canceling all this shit like they are, South by Southwest, Ultra, all these huge festivals and stuff. Disney World with the what? I've never seen that in my life. I've never seen NBA games canceled indefinitely in my life. March Madness ever in my life.
Yeah. And while we're back on the sports briefly, I am seeing some just reports about them saying, okay, right now it's going to be 30 days for now, and then we're going to see Adam Silver saying it'll be 30 days, and then we'll revisit. But again, they've got, like you said, they've got the, they're doing the testing and doing whatever they need to do. So if they've got, if they've got some things in place, then okay, but 30 days of that's still quite a bit of money being lost. And there are a couple of people I see, the Cavaliers have shared that they're going to help the people that are affected that typically would work in the arena, not the vendors, but, the workers there, that they're going to try to help compensate them still so that they don't miss pay over the time during the season that they're going to be out. They don't know how long. First they said suspended the season, now they're saying 30 days. They don't know, but at minimum, 30 is the update. And then you've got Mark Cuban who's already trying to put some things in place as well for the team, and so for the workers as well. It's getting, like you said, we haven't seen this before. We haven't seen this before. Very, very serious. And then again, back to that thing about people saying, "Oh, the kids, they're fine." Okay, but who's gonna be here to take care of the kids if everybody else is out of here or sick? Like, you know what I mean? We have to. Come on now, let's get it together. So we'll see. We'll be on top of it, but that,
Yeah, most definitely. Monday, we're gonna have the experts on with us. That's how serious it is. Entertainment got to take a back seat. This is some real shit. Like, we don't know where this is going. Hopefully they'll get a handle on this quick. But right now, it's a weird time. It's a lot of money being lost. Whenever you see a lot of money being lost like this, you're talking about an economic recession that we could be looking at. You're talking about a straight up real recession that quick. Let's pay attention. You could be sick a little bit and get over it, but you might not be able to get over this money hit. You might not be able to get over this economic hit. There's a lot of things that come with this shit. So we're going to talk about it. We're going to continue to speak about it, and we'll be back on Monday for that. Global 14 The Cut.